Hello, everyone. Welcome to Beyond Type 2. I'm Tiara Smith, and I'm the Senior Project Manager of Beyond Type 2. Beyond Type 2 provides practical resources for people impacted by diabetes. And if you watched my previous discussion with Eugenia Gianos, the cardiologist from Northwell University, you'll see that today we're going to be talking to a patient today about cardiovascular disease and type 2 diabetes. I'm so excited to be joined by Paul McGreavy, who is a patient with type 2 diabetes and also has a history of cardiovascular disease. I hope that you enjoyed this discussion because it is important for people with type 2 to be aware of the risks of developing cardiovascular diseases. And I'm going to introduce Paul. Paul,
Hey,
introduce yourself to our audience.
okay, hello. I'm Paul McGreavy from the United Kingdom. Um, I'm 62 years old. I'm reasonably fit, um, but I suffer from CVD and have fairly recently been diagnosed as diabetic, type 2 diabetic. So I'm happy to share what I can with everyone, just to try to dispel some of the fears that people may have.
Yes, and I'm excited to talk to you because I think that fear aspect is something that lives in the minds of people with type 2. Generally, when we talk about type 2 diabetes, there's definitely a fear component. So today I'm hoping that people will feel more empowered to have these discussions with their providers instead of always worrying that, oh my God, I'm gonna have a heart attack or I'm gonna find out that I have heart failure. So let's dive into your type 2 diagnosis story. How did you find out you had type 2 diabetes and how did your doctor decide to treat you?
Okay, it's difficult. I think my case is fairly atypical. As I said, I'm 66 years old now. When I was 62, I had an NSTEMI, really a very mild heart attack, which put me into hospital for about a week. Um, that came as a bit of a shock to everyone concerned because I'd not had any real chest pains until the day that I had the NSTEMI. I'd not had any indication at all that I was going to have a heart attack. My father had had angina when he was alive, but that was the only the history of heart disease, cardiovascular disease that we had in the family. So I ended up in hospital. I had a stent fitted, came out, and basically got to work on my rehabilitation. After, I guess, 6 months, I had a medical checkup with my GP, my general practitioner, and they did blood tests. My GP essentially said, we need to do some more blood tests because there's a problem with your blood sugar. Um, that kind of went on for a while, and I was then diagnosed with uh, diabetes, but it's kind of borderline diabetes. So here I am. I think it's atypical because I was suffering from CVD first, and then discovered that I was suffering from diabetes. I think a lot of people who have these problems have them in the opposite order to the one that I've experienced. So it works differently for different people, I guess.
And did you know anything about diabetes or and you say your father had angina, but did your father have type 2 and did you know about type 2 diabetes before your diagnosis?
Well, yeah, I mean, I have a kind of a semi-medical background. I used to still do a lot of mountain sports, and here in the UK, the place that I live in the UK is in a national park, and I was involved in mountain rescue within the community, and so the training that I had obviously prepared me for both dealing with cardiac events, but also dealing with diabetes amongst other conditions, because people in the mountains do have those kinds of problems. So I did know about it, and so it didn't phase me. It didn't come as a shock that I'd kind of had this lightning bolt of diabetes that hit me. It was something that I kind of know the medical issues that are around with it. So I suppose I was reasonably able to cope with it, perhaps because it's something that I'd seen other people experiencing.
And how did your doctor decide to treat you in that moment, especially with your history of CBD? Did you have to make major changes to your life?
Okay, yeah. Basically, obviously, with the cardiac event coming first, um, I guess I was attuned to the fact that I'm not immortal, and so things about getting older and coming to terms with physical illness, which I've never experienced until I was 62, um, was there, and I was kind of coming to terms with that, and then this was just another layer.
Mhm.
To me, it was just another layer that kind of hit me. And so I have support. My wife is very supportive, and she was there to help me.
Mhm.
My friends are very supportive.
Mhm.
Uh, in terms of my the medical news, it was basically my doctor who said, "Look, we've done these tests.
Mhm.
Um, they indicate that you are
Mhm.
um, pre-diabetic, and unless you actually move your lifestyle, you will become diabetic." And so I did then have a long discussion with my GP about that. And essentially, I guess the main changes that I've had to make have been around, I guess, diet more than anything else. I've
Yeah.
always taken lots of exercise. In fact, if anything, I'm probably slowing down on the exercise,
Mhm.
purely because my knees don't work, and when I go skiing, I manage to break things nowadays. So that kind of slows it down a little bit.
Yeah.
But yeah, the main lifestyle changes, which are the ones that my GP recommended, uh, revolve around diet more than anything else.
Yeah. And what changes to your diet did you have to make? What were you eating prior, I guess, prior to your cardiovascular event? And now, what's your diet like now?
Um, I mean, we live in the Western world, and lots of the kind of food that we get, whether we see advertised on TV, that we see in the supermarkets, is processed food. So the first thing I try to do is to reduce, rule out, if I possibly can, processed food. It's not very easy. Um, my wife kind of is worse at it, if anything, than I am. She'll come home with a nice pie or something like that, whereas I'll sit down and I'll cook fresh vegetables. Cutting down on things like red meat is something that I've tried to do, though I love a good steak, and still have them. Cutting down on sweet things. I mean, I've never been a real consumer of sweet things other than pistachio ice cream. But I can't remember the last time that I had pistachio ice cream. So
So
that was a a real sacrifice. Um, but things like that. Yeah, I've done, and I've come to terms with it. My wife is slowly coming to terms with it as well. Um, so it's that kind of thing. And the big thing is um, really I guess my GP, who I have a very good relationship with, said cut down on the quantity.
yeah.
And that's something, again, it's a first world issue, isn't it? That
Mhm.
we tend to eat far more than we need to eat. So the calorific intake, I've had to cut down on. Um,
Mhm.
and I think probably I've kind of um, kind of achieved a reasonably good weight, which I think probably in the latter few years I was a bit overweight, despite the fact that I was kind of exercising a lot, mountain biking, kind of hiking trails around where I live, cross country skiing, but I kind of I put on weight, and I think I just put that down to, I guess, the English call it middle age spread.
Yeah.
I was kind of getting a bit too fat. I think I'm probably still a little overweight. But here in the UK, we measure our weight, or I do now, in kilos,
Mhm.
and I'm averaging out at about 92, 94 kilos. So I think my BMI is a bit high for what it should be.
Yeah.
But you know, I have gone down below 90, and I think I look a bit like a kind of a skeleton when that happens. So I probably am a bit overweight, but nonetheless try to maintain a weight that I think is a healthy weight.
Yeah.
Probably a bit too overweight.
And like one thing we were talking about in some meetings that I've had with the people at Global Heart Hub who we're in a coalition with, we talked about the importance of like having that connected care between your GP or diabetes specialist and your heart specialist or cardiologist. Do your doctors connect with each other about your care?
The way that the system works in the UK is that the gatekeeper to the whole system is your GP. So I live within a 5 minute walk of the medical centre that my GP will see me at, and if I go to see him, then the whole thing goes through him, unless there's some speciality care that's required. And you know, quite fortunately, I haven't required any of that speciality care since being diagnosed with diabetes. Um, so I think, you know, I'm managing the condition, working in partnership with my general practitioner. But I know that under normal circumstances, if there was a problem, I would be referred to one of my local hospitals. And there would be either a cardiologist or whatever specialist to support me. Um, because I do some work with the Global Heart Hub and the European Society of Cardiology, I have a kind of a back door into kind of help and support as well, which is probably not what the average person would get. But I mean, that's something else. I think one of the issues that I have had to face, I kind of alluded to it earlier, is this idea of suddenly discovering that you're not immortal, that you get into your 60s and you start to suffer from kind of diseases that might be loosely associated with aging. And so part of my mental and emotional um, preparation for being having this physical state is to actually get involved in patient advocacy. And so I think that's really important, as well as the physical issues. And that's where I guess I get a lot of support from organizations like yours,
Yeah.
Global Heart Hub, and European Society of Cardiology.
Yeah.
That's equally as important as the physical, I think.
Absolutely, and that patient advocacy is it's how you get patients to learn how to ask certain questions when they do go to their providers. And part of that connected care is having your general practitioner or your PCP explain the connections between cardiovascular disease and type 2 diabetes. Did your after both of your events, did your doctors like tell you the importance of connecting type 2 to CVD and CVD to type 2?
Uh, I've got to be honest and say no.
Mm,
That was one thing that I think that there was a gap
mhm,
between me having NSTEMI, which was dealt with. The acute medicine that I was provided with was fine.
mhm,
Um, and then 6 months later, having blood tests without kind of being having the reason for the blood test explained to me until there was a negative result.
mhm,
At that point, then obviously we started to discuss that. I started to discuss that with the GP,
mhm.
and it was only at that point. So I was not completely prepared for that,
Yeah.
and that did come as a bit of a shock.
Yeah, that's it's super interesting because one thing that we did talk about in some of our coalition meetings is how many people with type 2 know or truly understand like the risk of experiencing a cardiovascular event. And to hear that you have experienced a cardiovascular event and you were also diagnosed with diabetes and there was still that gap in care,
Yeah.
it makes you wonder, the people who haven't experienced one or the other and don't know the connections.
And that's exactly why I'm talking to you today,
Yeah.
because what I want people to understand is that there is a link,
Yeah.
and the link is often the opposite way round to the link that I have, in the
Mm-hmm.
sense that diabetes tends to come first, and then CVD comes later.
Yeah.
But it can work both ways,
Mm-hmm.
and that's really crucial. And I think, you know, if nothing else, the takeaway message that I want to give today is that the two are related,
Yeah.
and you need to be aware of both.
Yeah.
You know, the ideal situation is to to really avoid both, and to, you know, a lot of the issues are to do with lifestyle choices.
Yeah.
But if unfortunately you find yourself in the kind of position that I've found myself in, is to really be aware that one could, you know, you always have to emphasize the could, it one could follow the other.
Yeah.
And lifestyle choices are actually a very good way of secondary prevention here.
Mm-hmm. Mm-hmm. And for people who are watching this and they're like, I don't even know where to start or how to like bring this up with my doctor, like what is like a question you will ask if you were visiting your GP or PCP and you want to know more about cardiovascular disease? How would you bring that up
I
with your
think
provider?
you just got to be kind of honest with yourself.
Mm-hmm.
You know, I guess I came at this 4 years ago in a state of ignorance, and so, you know, what I'm saying now is, if I knew then what I know now, I'd start asking questions, and, you know, I'd look at the ways in which I could actually prevent that cardiovascular disease
Mm-hmm.
taking hold. And I shouldn't be asking them at age 60. I should be asking them at age 20,
Yeah.
and, you know, looking at ways in which I can guarantee a healthier
Yeah.
older age.
Yeah.
And I think that's really important. It's about primary prevention.
Yeah.
Um, and I think, again, this is why I'm talking to you today. That I think it's really important that people take these messages on board, and think about how they organize their life, you know, and to remain physically active, to maintain a kind of a sensible diet, to avoid a lot of processed foods and things like that. It's, you know, there's so much literature out there, and I think most countries in the Western world now have um, organizations which will provide advice on lifestyle choices, advice on what to do if you feel that you are having a problem with with diabetes and blood sugars, or if you're having a problem with your heart. But
Yeah.
actually, the important thing is to prevent rather than to patch up after you've had a problem.
Yeah. And one thing that's set in force both CVD and type 2 is to know your numbers. And I think those numbers are like A1C, blood glucose, and of course, cholesterol, stress management, and smoking. So, how do you like? Which numbers do you know? Do you focus mainly on blood pressure, or do you watch cholesterol? Um,
Uh, to be honest, because I'm taking a kind of range of medication now, so I'm taking a beta blocker, I'm taking um, aspirin, and I kind of I focus on the cardiovascular elements of this,
mhm.
and it's on blood pressure. And, you know, using though I haven't got a smartwatch on at the moment because I can't put a watch over
Right.
the cast. But, you know, I do kind of wear a smartwatch that actually monitors a whole range of things that I'm doing, particularly, you know, when I'm exercising.
Yeah.
And you know, now I'm maybe a bit more careful about things like exercising. So trying to keep the heart rate down is an important one.
And one thing that I discussed with the CV expert, Dr. Gianos, we talked about the new the rise of drug therapies that benefit cardiovascular risk, as well as like treating type 2 diabetes. So GLP-1s and SGLT2s. Did either of your doctors tell you about those medications?
No, it's one of the things that I think certainly that there's an issue in the UK with communication about people's um, people's stats.
Mm-hmm.
Because I think there are two problems. One is that the communication does tend to be a problem, and that's a cultural problem, I think. The other one is at the moment we're dealing with the COVID pandemic, and I think there are issues around just the overload that the health service in the UK has at the moment. So yeah, there needs to be, I think, a lot more specific information about the whole process of looking at observational data that people can relate to their own personal health. And we don't do that in the UK. We should do.
And that's definitely something for I think for all type 2 patients, because one
Mm.
thing we've noticed that people with type 2, the care isn't too much different in terms of like the advocacy and the lack of communication and education in the US or the UK,
Yeah,
and even with some of our friends in other European countries. Um, but knowing that these medications exist are important, because for these medications, regardless of your A1C goals or even if you're on metformin, doctors may still recommend them to you if you either have like an established risk of
yeah,
cardiovascular disease or you're at high risk for it.
yeah,
Uh, so it's important really for people to know that these resources are available and to bring them up to their doctor, and
yeah.
then of course go from there. And finally, I guess you've already like given some take home messages, but do you have any other take home messages that you want people with diabetes to take home after watching this conversation? You've definitely talked about the need for asking early and like
Yeah.
definitely understanding where you are, learning how to age in a healthy way, and prevention with lifestyle choices. But any other take home messages that you want people to get from this conversation?
Well, I think you've covered all of the things that I would say, but I think the one that say is really important for people who are in my position to
Mhm.
start with is having a positive mental attitude
Mm.
and taking that with you, because that is a really important part. You can't allow these things to win,
Yeah.
whatever they are. You've got to make sure that yeah, you're still doing doing life.
Yes.
That's really important. Okay, there are some limitations on things that you can do now, so you can't enjoy the kind of food that you maybe enjoyed 20 years ago, but you can still enjoy life. And it's really about positive mental attitude, as well as really thinking about how you can make your body work for you.
Yes. Absolutely. And I hope people do feel empowered by this and like not scared about the chances of getting cardiovascular disease. Like it is definitely a risk if you have type 2 diabetes, but I hope people feel empowered to just go to their providers and
Yeah,
start having these conversations and talk about ways that you can reduce your risks on a regular basis, and like some small easy changes that you can make
yeah,
to your life to do that. Well, Paul,
absolutely.
thank you so much for joining me. This was great. Your experience is so valuable, and I'm so glad that you're a patient advocate for people with CVD and type 2. This is fantastic. Thank you.
Well, thank you for inviting me to talk to you.
Thank you. And everyone, I hope that you enjoyed this conversation. Please go to beyondtype2.org to see more of our health resources. I'm sorry, I'm going to do that again. Okay. Thank you, everyone who tuned into this conversation. Please visit beyondtype2.org for more resources on heart health and type 2 diabetes. And also, thank you to Global Heart Hub, who connected me with Paul, in our efforts to raise awareness for people with type 2 diabetes. And we'll see you next time.